I'm frequently asked, can I freeze PRP? But there's a better question. That is, should you freeze PRP? Let's first discuss the reasons in favor of freezing PRP. We consider PRP to have value. So if we have extra, we don't want to waste it. We've all had patients where collecting blood can be difficult. Well, this could mean one less blood collection. And lastly, if you don't have to open another kit, you save some money. Before we talk about the reasons not to freeze PRP, let's go over the activation process. So platelets, first of all, contain a variety of organelles. The one we're mostly focused on is called the alpha granule. This is what contains the growth factors involved in wound healing. Those growth factors are released when platelets are activated. And as the name implies, activation is an active process. During this process, the alpha granules will actively migrate across the cell, where they will merge with either the cell membrane or the endoplasmic reticulum. Either way, they're going to exocytose and release their growth factors into the local environment where they can coordinate healing. Now you notice though the rest of the cell contents remain within the cell, and then that platelet will get cleaned up after the fact by macrophages. Let's contrast what happens when a cell freezes. Ice crystals will form, and these will tear apart the cell. Now, everything within the cell could potentially be released, including things that we know to be pro-inflammatory, such as fragments of cell membrane and lysosomes. This study out of the University of Florida shows that frozen is not the same as fresh PRP. So the researchers made PRP and froze it in a variety of conditions. It didn't matter what condition they used, the growth factor profile was not the same. So when they looked at insulin-like growth factor, which is specifically indicated for tendon healing, it was decreased in all conditions. Equally concerning was the presence of pro-inflammatory mediators. So specifically this enzyme called MMP. This is an enzyme that breaks down collagen. Clearly not a good thing if you're putting PRP into, say, a tendon or a joint. So their conclusion, frozen PRP is not the same as fresh. Frozen PRP could be less effective because it doesn't have the same growth factor profile, and it could be pro-inflammatory because it has more of these catabolic enzymes. There's also in vivo data to support this. This is a beautifully written review article that looked at 19 studies using PRP in humans for osteoarthritis, almost 2,000 patients. And they found the best outcomes were when fresh PRP was used, not frozen. There are also regulatory and liability concerns that most people don't think about when they consider freezing PRP. So PRP kits are medical devices, and those are regulated as such by the FDA. But the PRP itself is considered a cell or tissue product, could actually be turned into a drug depending on the actions of the clinician. So the FDA has this kind of list of check boxes, and if you check one of those boxes, you've now turned that PRP into a drug. One example would be allogeneic. So if you drew blood from patient A, made PRP, but then put that PRP into patient B, you have created a drug. Now what that means is you would be subject to all of the regulations of a major drug manufacturer. Well, one of the tests they have is called the same procedure test. So this is, with very few exceptions, the FDA does not allow clinicians to take something out of the body, store it, and return it at a later date. This is why blood banking is highly regulated. So what does same procedure mean? Typically the same office visit. At a minimum, it should be the same day. Now, is the FDA going to knock down your door? Probably not. But what it does set you up for is liability concerns. There is no established case law that I'm aware of to test this water, but I certainly want to be the first one to find out. So to summarize, the reasons in favor of freezing PRP come down to three things. You're not wasting extra, minimize blood collections, and you can save some money. The reasons for not freezing PRP, regulatory issues, which can lead to liability issues, but possibly more important, frozen isn't the same, and the best available evidence shows frozen doesn't work as well. So what's more important, a little bit of convenience or saving some money, or practicing best medicine? So going back to our original question, can you freeze PRP? Yes. Should you freeze PRP? The answer is clearly no, you should not.